joining us for this early edition of our regular Thursday COVID-19 virtual media briefing on the pandemic situation in London and Middlesex County. We're glad to have you along with us and glad you could make the time to join us a half hour earlier than normal. We're very happy to be joined this afternoon by the Mayor of London, Ed Holder, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. Welcome to the media in attendance this afternoon, and a thank you to those of you who've already submitted questions. If you have yet to do so and you're new to our briefings, to submit a question, just click on the text bubble with the question mark in it here on Microsoft Teams. And if you could, indicate your name as well as your media outlet and who your question is for. And finally, a welcome to those joining us this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio 980 CFPL, and those who are watching us on the CTV London website. Let's get to the opening remarks right away, and let's start with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. You know, it's truly remarkable how far we've come in a relatively short amount of time. It wasn't that long ago, maybe only a few months removed, when we were screaming for more vaccine. Demand far exceeded supply. Well, as of today, and I find this incredibly unfortunate, supply far exceeds demand. And let me explain. There are currently more than 21,000 doses of Moderna vaccine that needs to be used up in the next 2 weeks. I can't tell you what's going to happen, but you can imagine what will happen if it's not used up in the next 2 weeks. You go in the garbage. There's absolutely no reason why every last one of those doses shouldn't end up in the arms of people in London, Middlesex. There are still 1 in 5 residents in our region who have not received a first shot. That's 20% of our population that's eligible. Appointments for first or second doses aren't necessary anymore. Aside from the vaccination clinics, there are many mobile and pop-up clinics. We have everything we need. What we don't have, though, is an excuse not to get vaccinated. Consider these numbers. Since mid-June, we've had more than 260 cases in London, Middlesex. Only 11 of those involved people who were fully vaccinated. So think about it. We had 12 cases today alone. If everyone had been double vaxxed since mid-June, we'd have just 11 cases in total over the last month and a half. Instead, we have 12 in a single day. What's more, since that time, going back to mid-June, we've had 13 people hospitalized due to COVID, and none, and I say none of those individuals had 2 shots. Not a single person in our region with 2 shots has wound up in hospital. Not a single person with 2 shots has died. You know, it's the same story that parallels across Ontario. Since mid-June, almost 96% of all COVID cases province-wide have involved people who were not fully vaccinated. 97.4% of all COVID hospitalizations involved people who were not fully vaccinated. These vaccines are safe, they work, and they're how we finally bring this pandemic under control once and for all. So I'm saying to the unvaccinated, wake up. It's time. We have 21,000 doses of life-saving vaccine, and it would be an absolute travesty if demand fails to meet the supply, especially when people in other parts of the world would do anything to be in our position. It's time. It's now. Over to you, Dr. Mackie.
Thank you very much, Mr. Mayor. You know, you really hit the key points on the vaccine campaign and the pandemic overall. We're at a crucial juncture. The Moderna doses that we have available now will save lives, will prevent people going to hospital, and we just need to use them before we run out of runway on August 12th for that. I also want to highlight a major accomplishment. This past week, we crossed over the 80% threshold. We now have vaccinated over 80% of everyone who is eligible in this region with 1 dose. Second doses are catching up. We're in the 60s in terms of the percent coverage for second doses. We need to get that up as well because that's crucial protection for that Delta. The other thing that I need to highlight today is a major issue that we are seeing at Middlesex-London Health Unit and that our partners in the community are seeing, and that's around intimate partner violence. We don't have perfect data on intimate partner violence. Part of the reason that this has changed is people are spending more time together at home. That's part of the pandemic. We knew that would happen. And that is affecting intimate partner violence. There's more contact and more violence happening. We don't have great reporting because it is often in this pandemic context more difficult for people to report intimate partner violence, given that there is more contact in the home. What we have been able to do is we've been able to speak with service providers. 86% of the people who are working in this sector have noticed an increase in intimate partner violence and an increase in the severity of intimate partner violence in this time. It's a very serious problem. Intimate partner violence is something the health unit has been watching and working on closely for many years. The injuries around intimate partner violence aren't just the physical injuries. The people involved, the victims, and also the children that witness intimate partner violence often have mental health impacts, including trauma, PTSD, depression, anxiety that can last for many years after the actual event. If you think that someone you know may be experiencing intimate partner violence, we would like to make some suggestions. First of all, please try not to be angry or frustrated. There are lots of reasons why people stay in relationships in spite of violence. It is a very complex, difficult situation, including reliance financially or for shelter, concern about violence. We know that violence does mount when people try to leave intimate partner violence situations, and concern for their children. Please do, if you know somebody who you witness or believe is experiencing domestic violence, talk to them about what you see. Tell them you're concerned about their safety, for their emotional well-being, and for that of their children. Tell them that you believe them, that it's not their fault. Make sure that they have some support to develop a safety plan. You can offer to provide childcare or pet care. Go with them when they seek help. There is a 24-hour crisis line. There are two options, a provincial and a local crisis line. I'm going to put both of those in the chat so that people have them today. Dan, that's it for me. Happy to take any questions.
Thank you very much, Dr. Mackie, and thank you, Mayor Holder. And yes, we will put those links in the chat so you'll have access to those very shortly. We do have a lot of questions, and let's get to those right away. And of course, several of them are about the Moderna vaccine. So let's go to the first one. It's from Jane Sims at the London Free Press. Dr. Mackie, this question is for you. About those 21,300 thawed Moderna doses, do you have confidence that they will be used here in Middlesex-London, or are there efforts to get them to other parts of the province that need them? Are people being picky about what mRNA vaccine they're getting?
So yes, and maybe. So the maybe is around the confidence for use. We are seeing good uptake. We're encouraging people to use Moderna, to receive Moderna in our mobile and mass immunization clinics, even the pop-up clinics. We will be in Victoria Park for RibFest this weekend. Very excited about that. And we'll have Moderna on offer there. There's Pfizer, of course, for youth who can't receive Moderna in all of those clinics as well. But Moderna is in all of our clinics, and we're seeing uptake there. So we're starting to work through that 21,000 or so. We have reached out to all health units. Unfortunately, many health units are in this situation or something similar. At least one other health unit has similar amounts of Moderna in fridges that we do, and trying to work through that. And many of the other health units have more than they need. So it's not a simple process right now to pass it to others. We all were really riding this intense vaccination train, 50,000 doses per week, where the demand, it's not the demand has dropped, it's the demand has been met. So that's the good news part of this story. But that happened very quickly. And so it was difficult to adjust appropriately over that time. Are people being picky about which mRNA vaccine they're receiving? Some people are. There's no doubt about that. We're seeing a lot of uptake, though. Over 81,000 doses of Moderna over the last few weeks in this community have been administered. And thank you to every single person who rolled up their arms for that.
Thank you very much, Dr. Mackie. Let's go to a follow-up question from Jane Sims. Dr. Mackie, with the reduced hours of the mass vaccination centers about to kick in, how successful have the mobile clinics been in attracting unvaccinated people? How many vaccinations are usually administered during those pop-up clinics?
Yeah, thanks for the question, Jane. So we have definitely seen success with all of our mobile clinics. They really vary tremendously in terms of the number of people that move through. And that's based on a few things, including the demographics of the neighborhood, the layout of the clinic and ability to flow people quickly, the amount of communication that happens by the health unit and partners to get the information out. It really depends on the community, the partners, and the group that we're vaccinating. The range is wide. I mean, there's been, since we began doing mobile outreach, there have been clinics where we had, something like 100 people move through in a clinic. There have also been clinics where we've been able to do more than 400 in a day, often in partnership with the staff of a facility like a long-term care. The sort of the average is something in the range of 200 to 300 vaccinations per pop-up clinic. So it's nothing like the 2,000 that you might, or 3,000 that might move through the agriplex on a big day. But it is important because we're reaching into places where there has been often limited uptake. And we're seeing consistently, at least 15, 20% of those vaccines at those pop-up clinics are first time. So getting new people onto the vaccine train. There are clinics where we've seen 30%, potentially more, that are first dose in those settings. But we're very happy to be able to reach out to people who otherwise wouldn't be able to make it into the mass clinics.
Thank you very much, Dr. Mackie. And a reminder, if you are a member of the media on today's call and you haven't asked a question yet, and you do have a question to ask, you can get those in. Once again, just click on the text bubble with the question mark, indicating your name as well as your media outlet and who your question is for. Back to those questions. Jacqueline LaBelle is joining us from Global News Radio, 980 CFPL. Dr. Mackie, why did the health unit decide to begin publishing cases by vaccination status? And why is this important?
For sure. We've really seen this pandemic become a pandemic of the unvaccinated. We're seeing a climb in cases among people who are unvaccinated. We felt that having this data displayed in the way that you see on the healthunit.com website would help people to understand that and really see that 100% of the deaths in the last few weeks have been among people who are unvaccinated. A vast majority of the hospitalizations, vast majority of the cases are in people who are unvaccinated or partially vaccinated. And that those who are vaccinated, are very well protected by the vaccine. That's what we expected from the research on the vaccines. But to see it locally it helps to paint the picture that this isn't just a theoretical benefit, it's a real benefit that is happening right now in our community for those who are vaccinated.
And a follow-up question from Jacqueline LaBelle. Dr. Mackie, can you expand on the situation with the excess doses of Moderna? Why were so many doses thawed in the first place, and how significantly have vaccination appointments dropped off?
Yeah, it's there were a combination of things. Jacqueline, really it is about that transition from very high volume clinics to sort of medium to high volume. Over the last few days, we've seen anything from 1,600 to 3,500 moving through per day compared to 7,000 at our peak. And so we had processes in place to draw out lots of vaccine because we knew there were clinics coming up with a lot of people coming to them, and often people booking very late. So, a few days out, you wouldn't necessarily know exactly how many people are going to be at the clinic because the bookings fill up over that time, or at least they were filling up. So we had these processes in place to draw out large amounts of vaccine to be ready. You can't, immunize with frozen vaccine, obviously. And so that was in place. And then on top of that, we had a large shipment of Moderna come in a week or two ago that because there was a freezer was full, so it got put straight in the fridge. And those two factors together just meant there was a lot of Moderna. Now, if we were still moving at the same rate that we'd been even a week ago with our vaccine clinics, we would have moved through that Moderna no problem within the next week or two. But because things have really, we've met the demand, and the demand isn't entirely there, that's where the mismatch is. What we're trying to do right now, number of strategies, really encouraging people, making sure Moderna is available everywhere, encouraging people to select Moderna. I know if I ever need a third dose, for whatever reason, I'm going to be getting Moderna. It's just as good as the Pfizer that I had the first time. But the other thing we're doing is we're calling everyone who has appointments over the next few months. So far it's been, please book your appointment earlier. We need to get everybody vaccinated with 2 doses for Delta. Now we're actually calling person by person, every single person who has an appointment from now until the end of our clinic appointments. And because we were booking 4-month appointments even 2 months ago, you've got thousands of people in that category who haven't rebooked for whatever reason. And we're calling them one by one and asking them to do that. And we know that will get through some of that. We're moving through in the range of 800 to 1,200 Moderna of that 21,000 per day in excess. So we're on track to move a lot of it through, but we need to get that even higher in order to make sure we're wasting as few doses as possible.
Mayor Holder, I think you've got a comment to add there.
Absolutely. There's an irony that it wasn't all that long ago, as I made reference to in my comments, that we had so much demand for our vaccines that we couldn't supply it all. Now, by virtue of, I think, the natural evolution of more people getting vaccinated and the increase in supply for obvious reasons, we are now in a situation where we have an overabundance of supply for now relative to demand. My sense, particularly as I think of the 20% who are not vaccinated, I'm not sure that we're going to get much more uptake on that. There are those who choose not to for any number of their reasons, until such time as perhaps they want to travel, or there will be circumstances where they cannot go somewhere unless they have been shown to have had 2 vaccinations. Here's the irony. At that point, because of the ebb and flow of vaccines, when these people want to travel and need to get their double shots plus the 2 weeks after for efficacy, for effectiveness, what if it's not there? What if we have a lower supply at that time? And you know what I will not listen to? I will not listen to the nonsense and the garbage volumes of people who say, but I demand my vaccine, when they could have had it today because they want to travel because it's the winter or whatever. Too bad. And you know what? I do sincerely hope there will be vaccine for them, but what if there's not? So we come back to that point. I think that will be probably the next upsurge beyond the 80% that we're in. Maybe the vaccine will be there, maybe it's not. And too bad for them, but so be it. And I'm talking about travel, and there may well be other venues and things or other work scenarios where a double vaccine will be required if they want to be able to go to certain places. So, interesting. I think we speak to the converted, and the others have shut themselves off till it's in their self-interest to make a different decision. I do hope the vaccine will be there, but the answer is then, who knows? So with that that's the Ed Holder Mercer rant today, because you get frustrated when there's a deep need to protect the community. And it isn't just the 20%. And don't believe that there's such a thing as herd mentality. There's herd mentality, but I don't think there's herd immunity. So lemmings represent herd mentality. But we said it, we heard it directly from the medical officer of health. It will be, as I said, the last press conference, this will be a pandemic of the unvaccinated. And why should we put healthy people at risk who demand certain healthcare services, when those who don't care enough about anyone choose to not get their shot, then they get sick and they soak up and use up our services. You see it today. The unvaccinated are the ones that are filling the hospitals. The unvaccinated are the ones who are getting COVID. Tell me how much sense that makes. So there's the rant. I'll leave it at that.
Thank you, Mayor Holder. And for those listening, I know these briefings are intended for the media, but I know that the message gets shared far and wide with the community as well through our media partners. We're grateful for that. And if you are someone who has not yet got that first dose or hasn't completed their 2 doses of vaccine and you're wondering where to go, visit the Health Unit website, healthunit.com/COVID and then a -19-vaccine. healthunit.com/COVID-19-vaccine. And you will have your options there on how you can get vaccinated as soon as possible. There are many options available. Let's go back to the questions. Jacqueline LaBelle has a follow-up. Dr. Mackie, what would the local situation have to look like for the health unit to reintroduce restrictions, for example, through Section 22 orders?
Yeah, I appreciate the question, Jacqueline. I mean, these are really case-by-case decisions. There is no recipe book for when to issue a Section 22 order. You know, the sorts of things we look for are large uncontrolled outbreaks that have significant health implications, hospitalizations, deaths, that sort of thing. There may be other situations between where we're at now and that, where a Section 22 order might be appropriate. We also, I mean, we do have provincial guidance on this, and the leadership of the province means a lot in terms of compliance with restrictions. At this point, we don't have conditions for a Section 22 order.
Thank you very much. And we have a couple of questions from Jerry Dewan at CTV London. Dr. Mackie, should you stop giving people a choice of vaccines in order to avoid letting Moderna shots expire?
Yeah, again, I appreciate the question, Jerry. This is, you know, the should question isn't really one that makes sense to me in this situation. What we have is competing issues of vaccine wastage versus individual rights and liberties. And especially in a healthcare situation where people voluntarily are coming forward to get the vaccine, it doesn't make sense in my mind to force them to take one type of vaccine when we do have the other available, and there is Pfizer available. So I don't quite see it that way at this point, Jerry, but you know, I appreciate the question. And since the beginning of the pandemic, people who live in London and Middlesex have really stepped up and done the right thing to protect themselves and to protect their neighbors and community. And we very much hope and believe that many people will choose to do that in this situation as well.
Dr. Mackie, if I could jump in for a moment, we hear about interchangeability all the time, and we talk about in public health that these vaccines are essentially the same, whether it's Pfizer or Moderna. And I wonder if it's worth going over that territory again one more time.
I mean, that's the underlying science behind the recommendation here. So we know that it's not just that the 2 vaccines, Pfizer and Moderna, have similar, you know, effectiveness and safety. The data is very clear there, but they are essentially the same medication. They just come with slightly different packaging, slightly different, you know, stabilizers and adjuvants, which help to boost the immune system. But the fundamental, you know, component of the vaccine is the mRNA, and that is pretty much exactly the same in the Pfizer and Moderna. So it's beyond interchangeability. It is that they are the same medication, just with different packaging.
Thank you very much for that too, Dr. Mackie. Let's go to what is right now our last question. So folks in the media, that's your final warning. If you've got a question to get in, now is the time. Another question from Jerry Dewan, Dr. Mackie. Quebec began letting people who received AstraZeneca receive a 3rd shot of mRNA vaccine in order to travel to countries that don't recognize AstraZeneca. Should Ontario similarly start offering third doses?
Yeah, the third dose approach in Quebec is not aligned with the Health Canada federal approval for the vaccines. It's not aligned with mainstream medical recommendations at this point. So it's definitely not the direction that we think needs to happen right now. There may be a time where we have evidence that a third dose of the vaccine is required to maintain or extend the duration of immunity, but we don't have that at this point. And from a medical perspective, it doesn't make sense to, prescribe, recommend a medication just to meet a political decision that some countries or some, cruise lines have made. I don't think that Ontario should be going in that direction at this point.
Thank you very much, Dr. Mackie and Mayor Holder. That does bring us to the end of today's questions. A quick reminder for the media and those in attendance and listening today, we, the Middlesex-London Health Unit, will be hosting an Instagram live event, our second in as many weeks, about the COVID-19 vaccine, pregnancy, breastfeeding, and prenatal health. Tomorrow afternoon, that is happening on the Health Unit's Instagram account. From 12:30 to 1:30, we'll be joined by Dr. Taryn Taylor and Dr. Carol King, both OBGYNs at LHSC and associate professors at Western University. And that 1 hour Q&A discussion will be moderated by the Health Unit's Stephanie Eggleton. So if you would like to join us for that, tune in to the Health Unit's Instagram account tomorrow between 12:30 and 1:30. And a reminder that our next virtual media briefing will be happening on Tuesday, August the 3rd, because we have the civic holiday on Monday and will not be having our virtual media briefing at that time. So we hope you will join us then, Tuesday, August the 3rd, for our next regularly scheduled virtual media briefing about COVID-19 in London and Middlesex County. Between now and then, have a wonderful civic holiday weekend, and so long for now.